Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We are looking at laser applications in case of the ENT. So what are the lasers used in terms of the ENT? First is we look at the ear. So in terms of ear, there is use of the carbon dioxide and the argon. So where are they used? They can be used in terms of the stapedectomy as well as a middle ear adhesion. Mid-ear adhesions. Next is we look at the nose. So in terms of the nose, there is polyps, the conditions as well as epistasis. So what is the laser used in terms of the polyps and epistasis? So in the nose, it is always the KTP. Then we move on to the larynx. So here in the larynx, there can be conditions such as laryngocele, there can be laryngomalacia. Next is the stenosis, the vocal fold polyps, as well as laser chordectomy for the vocal cord paresis. Or the vocal cord paralysis. So this is all this, there is use of CO2. So in terms of larynx, it is always CO2, in nose it is KTP, and in ear it is CO2 and the argon. Next we move on to the oral cavity. So here in oral cavity, what is present? So in terms of oral cavity, there is the use of the carbon dioxide, CO2. Then what are the conditions? The conditions it can deal with is the malignant. Malignant, you have leukoplakia as well as the erythroplakia. Next is the carcinomas. Carcinoma, they can be verrucous as well as a superficial T1. Next will be the lymphangioma as well as the lingual tonsils. We are writing it as LT. So all this has use of the carbon dioxide. Next is the OP, that is the oropharynx. Oropharynx, it can include the palatine tonsils. In palatine tonsils, the KTP is preferred over the CO2. The other KTP where we saw is in terms of the nasal procedures, polyps and epistasis, KTP was used. So the other conditions in the oral pharynx, they can be T1 and T2 SCC. T1, T2 SCC is there is use of carbon dioxide. Next will be the sleep apnea. So in terms of sleep apnea, there is use of KTP. So sleep apnea, there is a use of KTP. Next is trachea. So in terms of trachea, it is obstructing malignant lesions. So obstructing malignant lesions. So here there is use of NDAC. So this is obstructive malignant lesion, there is use of NDAC. To learn and grow daily like this, please do subscribe.